all of you for participating. It's so great to see a Californian on the panel. And for that reason, little hometown love, I'd love to sort of start with you, Ms. Palka. We are one of the most diverse states in the country, representing 40 million Californians and a vast array of racial diversity, ethnic diversity, and language diversity. And we, given our size and scope, our diversity that makes us such a great state, the challenges of making government work for California residents is a challenge that you've taken on behalf of Governor Newsom and our EDD team. I am curious about the ways in which these technologies can be deployed to further accessibility as well as just getting people what they need on an everyday basis. The pain of getting a driver's license, the pain of getting a passport or getting your call returned. How talk with me a little bit, share with the committee a little bit about how we can embrace all that makes us great, our diversity and all of the things that really make our country the melting pot that it is, and deploy technology in order to make our government, again, more accessible for those whose first language may not be English, and make sure that it works in a way that people can get exactly what they need when they need it.
That is an inspiring question, thank you, and I'm glad that it came from our senator from California. We've mentioned earlier that translation is one of the things AI is fantastic at. So when I worked on the task force for unemployment insurance during the pandemic, translation of the whole process, not just the application form people would use online. Of course, we had a problem with the call center, but if you were able to call, were you able to get through and talk to somebody in the language that you knew so that you could actually get the help you need to get your unemployment insurance check? And of course, we're at a moment in time when there are tools available that could make that a lot easier. I've spoken before about the need to streamline procurement so that tools like that could be procured more easily. I also think it's really important to recognize that when people call, they don't just want to be able to talk to somebody in their language, they actually need an answer. And it's wonderful if someone can pick up the phone, but much better if they can say, your check is coming. And in order to do that, I do think we need to simplify the policies and processes and regulations that cover a program like unemployment insurance. It is staggeringly complex for something that really is not that complicated. We're going to take your pay, your previous pay and some portion of it, and you're going to get that when you're out of work. We've made it into 10,000 pages of regulation. I mentioned how people working at the EDD in California were still learning the ropes after 17 years. So, of course, it's hard to get an answer under that incredible burden of complexity, and we happen to be at a moment in time when AI could help us reduce that complexity. It can't do the work for us, but it can help us understand what's in those 10,000 pages, suggest simplifications, and then lawmakers could work to make that a program that is a little bit easier to administer. When I worked on unemployment insurance, and I hope this speaks to your question, not just the particular example, but we had a legislature who passed a law right when we were trying to get through that backlog that was designed to help people who didn't speak English. And as much as I'm a fan of the need to do that and feel very connected to the need to serve those folks, it was an example I felt of adding a mandate when what was needed was enablement. So one of the things we could have done at that time to subtract rather than add would have been to remove the requirement that call center agents had to get permission before they could use the translation service that was currently available. And Instead, we said, here are new mandates for translation of the website, which distracted, frankly, from the ability of the EDD at that moment in time to work through the backlog. The thing they needed to do the most at that time was get checks to what turned out to be 1.3 million people. And sometimes we need to recognize that we have to have priorities in order to serve people. There were many people in that 1.3 million claims backlog who were underserved, represented the diversity of California, and they actually didn't need at that moment, a different way to read through this web form, which was already so complicated. The language in it was so complicated in English that translating it into another language wasn't going to help. What they needed was their check. And sometimes we need to have better communication between agencies and legislators to understand what is the thing at this moment in time that will enable the right outcome and set some priorities and have the translation stuff come later. I hope the translation stuff does come later, but I also hope we use the tools of AI to do it instead of doing it in the mode that we've been doing it over the past 10 years.
Thank you.
Thank you.
Very responsive to the question and a continued incredible example for California. My last question, I want to just really quickly move from maybe customer service to thinking about help us to think about how to better create the guardrails, enable the tools to also supplement direct services and challenges that we have as a nation. Across the country, there is both a mental health crisis as well as a mental health worker crisis. I was reading, it's Los Angeles being one of the largest mental health providers in the country, that they also have more than 1,800 vacancies in mental health provision. But have been reading a lot, about chatbots that are being able to be deployed to offer initial support where we may not have a worker at the ready to support the kind of one-on-one interaction that's required during mental health counseling and services. Are there, and nationally we have as a at the federal level, a national healthcare worker task force, understanding that we have a shortage around the country and a challenge that we've got to address. Can you talk more, either of you, about the deployment of artificial intelligence, the usage of chatbots in a way to support the existing workers and their work, even as we have these sort of challenges of attracting more and creating more opportunities for workers in the space?
So it's such a wonderful question, and I want to combine it with some of our focus also on government customer service here. I think one of the exciting things about these technologies is that they are what is sometimes referred to now as multimodal. That is to say, they talk as well as they type. So that means we have conversational agents, a tool I'm thinking of like Pi, which was designed by the person who actually created the UK's largest helpline for Muslim youth. Precisely in order to offer that responsiveness, that sense of talking to a person, which can really provide a lot of psychological support for people in the first instance. So we're seeing this ability not only to give people chatbots in the sense of typed responses to questions, whether it's for residents or whether it's for employees, but also spoken responses to questions to provide that added level of customer service. And I think that's hugely important, whether it's in the mental health space, which is outside my area of expertise, or whether it's in the government customer support area. So this ability now to provide people with that kind of responsiveness, I think is a hugely important, and we're going to see the use of these tools only grow. Of course, we need those guardrails to ensure that we are confident about what the information is that's being provided to people, that we're not taking advantage of people in a vulnerable state. And that's why doing things in a human-centered way, whether that's with residents or whether that's also with government workers and government employees, talking to them about what do they need and what will actually help them is really crucial. And last point here is, what's exciting about a lot of these tools is you can also train them to respond on a specific corpus of information. So it's not the world of ChatGPT and the open web that we know where it might pull from anywhere on the internet, but rather the idea now, for example, that my students are working with Mass DOT to say, let's upload their manuals, their procedures, their policies, and then provide a tool so that new engineers coming into the agency can ask a question like, what's the rule on this or what's the policy about that, and to pull the answers only from those documents. That helps provide an added level of safety and security to be sure that we know what the answers that people are going to get, provides that conversational element, and again, it provides that opportunity, though, to make it much easier than reading 1,000 documents and having to pour through them, enabling those new employees that we're bringing in not to burn out quite so fast, but instead to be excited about the opportunity to do public service.
Thank you, Senator Butler. Dr. Dovik, New Jersey is one of the first states to develop guidance on how employees should use AI. So if you would, for the committee's benefit, kind of describe that guidance, and more importantly, perhaps, how is it actually working in